Well, the SAG-AFTRA strike is entering its fourth week with no clear end in sight.
Actors are demanding increased pay, better residuals, and protections from having their likenesses used by AI technology. SAG-AFTRA says more than 99% of its 160,000 members are working-class actors who aren't making multi-million-dollar salaries. The union says their demands reflect very real needs, like paying rent and accessing health insurance between jobs.
Let's bring in actor and healthcare advocate Brooklyn McLinn. Brooklyn, thanks so much for sharing your perspective here. Explain to us how healthcare coverage works for union members. How many weeks do they need to have worked to receive benefits?
Weeks, I'm not sure. I think it's like over 100 days you have to work within the union. But the monetary number is 26,000 that you need to earn for a certain quarter to qualify for health insurance.
So what happens if you don't work those 100 days? What happens then? Do you lose coverage?
Yeah, no, pretty much. If you don't earn the money necessary to qualify, then you just don't have coverage, which is really unfortunate because, you know, like you stated earlier in the intro, the majority of the union is check to check. You know what I mean? I think it's like 86% of the union members don't qualify for insurance. And I think the public confuses the 1% of the famous people that we see and know by name with everybody in the union. And that's just so untrue. But fortunately, there was an announcement made yesterday through the SAG-AFTRA Foundation that many of those people that we know ponied up millions of dollars to help out the foundation to bring some relief to those union members that are struggling.
So, Brooklyn, we've got tens of thousands of SAG-AFTRA members whose insurance is in doubt right now. Let's say one of them suffers a serious medical issue. Are there any safeguards in place for them right now?
There's some safeguards in place. Obviously, I went through some serious health troubles. Recently had a heart transplant 2.5 years ago. So when I was going through my stuff, I was a naive one. I actually qualified for insurance and didn't think I needed it, as most knucklehead men do. And I was able to get that insurance back. But after the transplant, I hadn't been working, so my insurance was running out. And so I was able to reach out to the SAG-AFTRA Foundation to bridge that gap for me. And it wasn't the same insurance, but it was very equivalent. It's called Cobra. It's way more expensive. It's like $1,000 a month. And I hadn't been working for close to 1.5 years just dealing with my heart and the heart transplant. So they definitely bridged that gap. And also the Motion Picture Fund stepped in and helped. And it bought me about 6 months to get back out there and get back to work. And fortunately for me, you know, speaking for myself, I was able to qualify again and now have the insurance.
Brooklyn, thank you for sharing your personal story with us. For most Americans, they either have insurance through their employer or they have it privately. They don't have the same experience that SAG-AFTRA members do, where they have to work a certain number of jobs. How does a prolonged strike potentially impact members' ability to have health insurance?
Oh, my goodness. I mean, just the thought of it is brutal. When you live in check to check, and I'm sure that goes for any American, you know, any work stoppage or any sudden, you know, emergency, you know, you don't necessarily have the funds to cover that. So a prolonged work stoppage between the SAG actors and then the writers also, you're actually risking people losing their homes. You know, we can't even really talk about the insurance if you don't have a place to live. So we talking rent, car payments, just your food necessities, like just day-to-day stuff. I personally think it can be pretty bad for a lot of people.
All right, Brooklyn McLinn, thank you.
No problem. Thank you.